Good morning to all. Today's topic is on gingival enlargement and its management. Learning outcomes are classify gingival enlargements and point out the clinical features of inflammatory gingival enlargements, identify the drugs that can cause drug-induced gingival overgrowth and analyze the mechanism of action, analyze the clinical and histopathological features of drug-induced gingival enlargements and idiopathic enlargement, distinguish between drug-induced gingival enlargement, inflammatory and idiopathic enlargement. Explain the gingival changes in pregnancy, vitamin C deficiency, and leukemic enlargement. Point out the histopathological changes seen in pregnancy tumor. Distinguish between fold gingival enlargement and other types of gingival enlargement. Inspect the given clinical features and identify the type of gingival enlargement. Diagnose few types of gingival enlargement cases. Discuss the pathophysiology of the various types of gingival enlargements. Outline the treatment options for various types of gingival enlargements. Gingival enlargement can be called as gingival overgrowth. So it is defined as it is called as increase in the size of gingiva. Whether in the number of cells or in the size of the cells, it is called as gingival overgrowth. So it has been classified according to the location and distribution. So that is divided it as localized, generalized, marginal, papillary, diffuse and discrete. So what is localized? As the name indicates, it is confined to a single tooth or a group of teeth. Whereas generalized, which involving the gingiva throughout the mouth. Whereas marginal, that is confined only to the marginal gingiva. And what is papillary? That is involving only the interdental papilla. And the diffuse gingivitis, that is involving the marginal and attached gingiva and papilla. So which involves all three parts of gingiva. And what is discrete gingiva? That is an isolated sessile or pedungulated tumor-like enlargement can be seen, that is discrete gingivitis. So this is the classification that is based on the location and distribution of gingival enlargement. Then comes the degree of gingival enlargement can be scored as follows. So it is based on Buckingham et al. In 1964. So that is grade 0, like no signs of gingival enlargement. Grade 1, enlargement confined to interdental papilla. Grade 2 enlargement involves papilla and marginal gingiva, and grade 3 enlargement covers 3/4 or more of the crown. So in our clinics, we are mostly following this scoring of gingival enlargement. So next is a broader classification of gingival enlargement based on etiological and pathologic changes. So that can be inflammatory enlargement, drug induced, or that is enlargements associated with systemic diseases or conditions. And neoplastic enlargement, it can be either benign or malignant, and then comes the folds enlargement. So we will be like discussing one by one. So first one, that is the most important, that is the inflammatory gingival enlargement. As we all know, there is a main factor or etiology behind this is the inflammation. So it can be chronic or acute. So under chronic inflammatory enlargement, you can see chronic gingivitis or the gingivitis in mouth breathers or plasma cell gingivitis. Whereas acute gingival enlargement can be seen in gingival abscess, periodontal abscess or lateral abscess, periapical abscess or pericoronitis. So we are moving on to the details of each. That is the inflammatory gingival enlargement. That is first we are going to discuss the chronic one. Chronic one, that is as the name indicates, you know, that is a prolonged exposure. If it is like response to a prolonged exposure to local irritation. So mostly it will be plaque induced. It is slow and painless and which bleeds easily. So occasionally it can be seen as a discrete sessile or pedungulated tumor. So out of this, the most important factor to note down is that is the slight ballooning of the interdental gingiva. You can see the slight ballooning of the interdental papilla and the marginal gingiva. So that is mostly seen in the chronic type of gingival enlargement, and it can be called as life server bulge. So that is the life server bulge can be seen in the chronic stage of gingivitis. So then comes that is the scene in gingivitis or gingival enlargement seen in mouth breathers. This is also a type of chronic inflammatory gingival enlargement. You can see in this picture that is diffuse redness and shining of the exposed area, that is you can see that is in mouth breathing patients. So these areas, these anterior regions especially, it will be exposed to the outer environment, so it will get dried easily. So we can see that is diffuse redness and shining of the exposed area, mostly confined to the maxillary anterior region, and irritation from surface dehydration. The next one under chronic inflammatory gingival enlargement is plasma cell gingivitis, which is a mild marginal extension extended to attached gingiva. That is the marginal gingiva, which is very less involved compared to the attached gingiva. It is more involved in the attached gingiva. So that is the main area, and you can see that it appears as a red friable granular and which bleeds easily. So it is associated with gingivitis and cheilitis. So it is more confined to the attached gingiva. That is a most peculiarity with this plasma cell gingivitis. And it usually occurs as an allergic reaction to chewing gums, dentifrices, or dietary items. So that comes under chronic inflammatory gingival enlargement. Comes acute gingival enlargement. Under that, like abscess, like gingival abscess, periodontal abscess, periapical abscess, or pericoronitis. Gingival abscess, it is more confined to the interdental and marginal gingiva, whereas periodontal abscess is more confined to the lateral aspect of the tooth, and periapical abscess, it is confined to the apical part of the tooth, and pericoronitis, it is more confined to the partially like erupted teeth or partially impacted teeth. So where there is pericoronum that is covering the tooth, so that if it gets inflamed, that is called pericoronitis. So then now we are dealing with the gingival abscess. As we said, it is more confined to the interdental and marginal gingiva. So when foreign objects, if it is get embedded into gingiva and complicated by resident microbes, this gingival abscess will get formed, and it is of sudden onset. It appears as fluctuant and pointed with a sulfus orifice from which a purulent axidate may be expressed, which occurs within 24 to 48 hours and which ruptures spontaneously. Then coming to the pathogenesis of inflammatory gingival enlargement. So it's like bacterial colonies that are the main causative factor for this and gingival enlargement. And if there is bacterial colonies, which increases the inflammatory edema and cellular exudate, which ultimately leads to the gingival enlargement. So when there is increase in the cellular component, there will be increase in the size of gingiva, so which leads to gingival enlargement. Coming to the management of inflammatory gingival enlargement. So that is a main causative factors to be removed. The local factors are the main causative factor for inflammatory gingival enlargement. So removal of causative factors, that is scaling and root planing. So if there is abscess, it can be treated by incision and drainage. Oral hygiene instructions should be given. And under surgical procedure, so if the causative factors are removed and then if there is persistent gingival enlargement, it can go under gingivectomy and gingivoplasty procedures if needed. The most important topic under gingival enlargement, that is the drug-induced gingival enlargement. It is a well-known consequence of the administration due to some of the drugs like anti-convulsant group of drugs, calcium channel blockers, immunosuppressants. Out of this, like more prevalence with the phenytoin, that is 50%, and nifedipine 6 to 83%, and cyclosporin 30%. So these clinical and microscopic features of all these enlargements by different drugs are similar. So like most of the factors that is mainly associated with this drug-induced enlargement, that is genetic factor, drug dosage, and so pathogenesis can be explained. That is the main causative factor, that is a medication that mainly acts on this fibroblast, so which leads to defective function of the fibroblast. So the proliferation, differentiation, and production, this all get affected by the cytokines and growth factors. So when there is defective function of fibroblast, what happens? And when there is increased number of fibers will be formed and depletion will be less, and also there will be decreased collagenase activity. So that increase collagenase proteins and increase production of matrix proteins. So this finally will lead to affected extracellular matrix metabolism. So clinical features that is mainly appear as painless bead-like gingival enlargement that is of the interdental papilla. So it will be like bead-like in the interdental papilla. So when this marginal and papillary gingival enlargements get united, it leads to massive tissue. That is, if it is uncomplicated, then it leads to the mulberry type shaped, firm, pale pink and resilient minutely lobulated surface and no tendency to bleed. So this is mainly the bead like you can see in this picture, the clinical diagram, that is the mulberry shaped. So when this get united, both the margin and papillary, it leads to mulberry shaped. Otherwise it will be like bead like papillary enlargement. So if it is complicated by secondary inflammation, it appears as bluish red obliterated surface demarcation which bleeds easily. So it will not be seen in the dangerous spaces, and it will affect like the occlusion, mastication and speech. Then comes like we are going to like details of each drug induced gingival enlargement. The first one anticonvulsant. So out of this, that is phenytoin is a main drug that is causing gingival enlargement. So that is a main drug of choice for seizures. So phenytoin stimulates proliferation of fibroblasts like cells and epithelium. Phenytoin may induce a decrease in collagen degradation as a result of the production of an inactive fibroblastic collagenase. So this is the main reason behind this drug-induced gingival enlargement. So which stimulates the proliferation of fibroblast cells and epithelium, and which may also induce a decrease in collagen degradation as a result of the production of an inactive fibroblastic collagenase. So that the collagen degradation will be more, so that increase collagen deposition, whereas there will be more proliferation of fibroblasts. Next comes the immunosuppressants. Under that, cyclosporin is the main drug that is causing gingival enlargement. So it is mainly recommended in children. So it is mostly seen in like patients with dosages greater than 500 milligram per day. So it is a main drug of choice for organ transplantation and autoimmune diseases. So it is seen as more inflamed and bleeding easily, and commonly it is limited to the buccal surfaces. So the main causative factor, that is hypersensitivity and collagen synthesis impairment, decrease expression of metallomatrix proteinases 1 and MMB3, that is MMB1 and MMB3, and non-collagenous matrix will get impaired. So these are the main reasons behind this drug-induced gingival enlargement. Next comes the calcium channel blockers. Under the nifedipine is the main drug that is causing gingival enlargement. Main drug of choice for cardiovascular conditions such as hypertension, angina pectoris, coronary artery spasms, and cardiac arrhythmias. And these are some of the like group of drugs that comes under this calcium channel blockers. So these drug enlargement, this usually associated with or coexist with periodontitis. So you can see that is it will be mostly associated with the periodontitis, there is bone loss, and the main reason behind the gingival enlargement is the decreased collagenase activity. So that decreased collagen destruction, so more deposition of the collagen, as well as decreased calcium in fibroblasts and T cells, so which leads to collagen biosynthesis. So these are the main reasons behind this nifedipine induced gingival enlargement. Then coming to the common management of all these drug-induced gingival enlargement, the first one is the mainly that is the scaling and root planing. That is the main causative factor that should be removed. That is scaling and root planing. And then comes the referral to the physician. That is for the substitution or withdrawal of drugs can be done. So that is like some of the options for the withdrawal. So surely we cannot do withdrawal of or substitution of the like epileptic drugs or any like drugs that can be that is used for other diseases. So it should be under the physician consent. So cyclosporin, that is tacrolimus, nifedipine can be replaced by isradipine, verapamil or diltiazem. Phenytoin can be replaced by carbamazepine and valproic acid. Okay, so this is a substitution or withdrawal, and these are the common drugs that can be substituted. And oral hygiene instruction should be given, scaling and root training. And if there is a like even after the alteration or substitution of the drug, still there is like persistent gingival enlargement, it can go under gingivectomy or gingivoplasty. And if there is like gingivectomy is not preferred, then it can be go under apically positioned flap, that is flap surgery, and then comes under maintenance. Then comes enlargements associated with the systemic diseases. Many systemic diseases can develop oral manifestation that could include the gingival enlargement. So it could be in either like the magnification of the existing inflammation developed by the dental plaque, or manifestation of the systemic disease independently of the inflammatory status of the gingiva. So under that, the first category we are going to mention about the conditioned gingival enlargement. So that is some of the systemic diseases like exaggerates or distorts the usual gingival response to local factors like dental plaque. So all these conditions, the local factors or bacterial plaque is necessary for the initiation of this type of enlargement. So some of the conditions like hormonal diseases like pregnancy or and puberty, and nutritional diseases like vitamin C deficiency and allergy, and non-specific condition enlargement is also seen. Coming to the pathogenesis, so like in hormonal conditions there will be increased amount of hormones like estrogen and progesterone, so which will be more in production by the end of third trimester, which reaches 10 to 30 times the levels present during the menstrual cycle. So these changes induce changes in vascular permeability, so which leads to increase in gingival edema and inflammatory response. So this increased permeability, which in which like in pregnancy there is found that there is increased prevotella intermedia and porphyra monogingivalis, and puberty they have seen that increased amount of prevotella intermedia and prevotella nigrescens. So pregnancy related gingival enlargement. Firstly, we are going to mention about the marginal gingival enlargement. So this is mainly due to the aggravation of previous inflammation. So it is usually occurs generalized, and it is prominent interproximally. You can see the interproximal region, it is very more prominent, and it appears as bright red or magenta, soft and friable, and with smooth shiny surface. Bleeding occurs spontaneously or on slight provocation. So this is the marginal gingival enlargement. Moving on to the tumor-like gingival enlargement or angiogranuloma, so-called pregnancy tumor, it is not a neoplasm. This usually occurs after the third month of pregnancy, but it may also occur earlier. And the reported incidence is 1.8 to 5 percentage, and this appears as a discrete mushroom-like flattened spherical mass, and which protrudes from the gingival margin of more the interproximal region. You can see this diagram. There is more will be with like mushroom like flattened spherical mass, mostly seen in the interproximal region. So it is attached by a sessile or pedungulated base which extends laterally. Okay, it appears as a dusky red or magenta. It has a smooth flattened surface which is very semi-firm, so it can be detachable, which does not invade the underlying bone. So you can see this pregnancy tumor like mushrooms lie, sessile or pedungulated base that extends laterally, and the most model the color is dusky red or magenta. Then coming to the puberty associated gingival enlargement. So enlargement of gingiva is sometimes seen during the puberty time. So it occurs both in male and female adolescents. So it is mainly occurs in the marginal and interdental and is characterized by a prominent bulbous interproximal papilla. So you can see this bulbous interproximal papilla. So facial gingiva are enlarged often. So it is generally associated with a chronic inflammatory gingival disease. Enlargement undergoes spontaneous reduction after plaque and calculus removal. So this is mainly associated with the puberty associated gingiva. You can see with the diagram that is the bulbous interproximal papilla. Then coming to the pyogenic granuloma, you can see the like tumor-like gingival enlargement. This is mostly like occurs as an unconditioned gingival enlargement. It is an exaggerated condition response to minor trauma. It is usually occurs as an exaggerated response to minor trauma. You can see this pyogenic granuloma. It is easily detachable. So it is similar in clinical and microscopic appearance to the conditioned gingival enlargement, that is pregnancy tumors. This is the same feature as that of the pregnancy tumor. So that is pyogenic granuloma. Coming to the management of hormonal associated gingival enlargement, the first causative factor should be removed, that is the removal of local irritants, followed by oral hygiene instructions and maintenance. So, in case of tumor like gingival enlargement, whether it's pregnancy tumor or pyogenic granuloma, surgical excision of the tumor is the treatment. So, for pregnancy associated gingival enlargement, for the pregnancy tumor, no need of surgery unless it interferes with any speech or the normal function. So it usually get regress after delivery, but it recurs without optimal oral hygiene maintenance. So this oral hygiene maintenance is very important for the for subsiding this type of tumor like enlargement. And for the puberty, it's like after puberty, spontaneous reduction can be seen in the gingival enlargement. Then comes nutrition associated gingival enlargement, that is the mainly associated with the vitamin C deficiency. So it is like enlargement of the gingiva is generally included in classic descriptions of scurvy. So it is mostly seen in the marginal region and the gingiva appears bluish red, soft, friable and has a smooth shiny surface. So it will be usually in marginal areas and bleeding occurs either spontaneously or on slight provocation. So sometimes the surface necrosis with pseudomembrane formation are the more common features. As you can see in this picture, that is, it is associated with the marginal region, and you can see the bluish red soft friable region. So mainly it is because of the vitamin C deficiency. So it does cause hemorrhage, collagen degeneration and edema of the gingival connective tissue. So these changes modify the gingival response to plaque. So this might be the reason for this massive gingival enlargement. So it can be seen in patients with scurvy. So pathogenesis, as we said before, the three main factors associated with the vitamin C deficiency are hemorrhage, collagen degeneration and edema of gingival connective tissue. Management, as we know, like vitamin C deficiency, so that increase in diet, counseling, that is changes in nutrition, you have to include more vitamin C containing food, and along with that, non-surgical periodontal therapy, that is a removal of causative factors, and if needed, supportive periodontal therapy. So coming to the systemic diseases that cause gingival enlargement. So several systemic disease may result in gingival enlargement by different mechanisms. So these are very uncommon cases and are only briefly discussed. So after this, leukemia is more important. So we are discussing leukemia alone. And other than that, granulomatous diseases like Buchnell's granulomatosis and sarcoidosis in Buchnell is a rare disease. So like lesions of the respiratory tract in which you can see like gingival enlargement and oral mucosal ulceration and tooth mobility. And this appears as a reddish purple and bleeds easily on stimulation. Whereas for sarcoidosis, that is also granulomatous disease of unknown etiology. So it predominantly affects blacks and it can involve almost any organ including the gingiva. So it appears as a red, smooth, painless enlargement can be seen. So next, then coming to the leukemia-associated gingival enlargement, it is mostly seen as diffuse enlargement of the gingival mucosa that you can see in this picture that it will be involving that margin gingiva, intertidal gingiva as well as the attached gingiva as a huge mass. So this is an oversized extension of the margin gingiva or a discrete tumor like interproximal mass. So it appears as bluish red and has a shiny surface. It will be moderately firm, so hemorrhage can be seen, like occurring either spontaneously or on slight irritation. In the interdental areas, you can see this acute, painful necrotizing inflammatory involvement may occur at the two gingival junction, that is mostly in the crevice region. Then coming to the idiopathic uh, gingival enlargement, that is due to the unknown reasons. So it can be called as gingivomatosis, elephantiasis, idiopathic fibromatosis, hereditary gingival hyperplasia, and congenital familial fibromatosis. This mostly affects the attached gingiva first, and then it involves the marginal and interdental region. You can see in both the maxillary and mandible, both buccal and lingual sides. So it appears as very pink, firm and leathery consistency. That is mostly with the increase in the fibrous component. So that is why it appears as a leathery consistency, and minutely pebbled surface can be seen. So it can be seen in some of the disease conditions, that is tuberous sclerosis, that is a triad of epilepsy, mental deficiency, and cutaneous angiofibromas. So that's all about the idiopathic neoplastic gingival enlargement. This could be benign tumors or malignant tumors. But this epulis, this is called as epulis, that is a generic term used clinically to designate all discrete tumors and tumor-like masses of the gingiva. So these are some of the tumors in which like gingival enlargement can be seen. So that is the neoplastic gingival. Then coming to the false gingival enlargement, that is not a true gingival enlargement. That is like some of the factors which causes the abnormal clinical features which shows it as massive increase in the size of the area. So it could be due to underlying osseous lesion or underlying dental tissues. So the first one, that is the osseous lesion, that could be like tori or exostosis. So this can be seen in some of the diseases like Page's disease, fibrous dysphasia, cherubism, central giant cell granuloma. All these you can see this tori or exostosis which appears as gingival enlargement. The other one is underlying dental tissues. So that is the reason behind this is the dental tissues that is usually seen in the eruption of during the eruption of primary dentition. So this labial gingiva may show as a bulbous marginal distortion. You can see in this diagram. So this is caused by the superimposition of the bulk of the gingiva on the normal prominence of the enamel in the gingival half of the crown. So coming to the overall management of gingival enlargement, you can see like when a patient comes with gingival enlargement, it could be inflammatory gingival enlargement, fibrotic gingival enlargement, or neoplasm. Under inflammatory gingival enlargement, that could be periodontal or gingival abscess or chronic inflammatory gingival enlargement. So under acute phase, that it leads to the established drainage and generally debridement, and recall the patient for next day, evaluate for further therapy when the acute symptoms resolve. So that is the acute gingival enlargement. So under chronic, as you know, that is mainly due to the plaque deposition. So emphasize the plaque control, eliminate irritants by scaling and root planing, and consult physician if there is any leukemia or vitamin C deficiency suspected. And if there is like persistent gingival enlargement, even after the removal of irritants and after the rule out of the other factors, we can go for gingivectomy or flap surgery according to the case demand. Next comes the fibrotic gingival enlargement. You can see mostly in the drug-induced gingival enlargement and hereditary gingival stomatitis or idiopathic gingival enlargement. For the drug-induced, as you know, that is mainly the causative factor is the drug that is using. So you can go for physician consultation, and also the local irritants should be removed by scaling and root planing. So even after scaling and root planing and after the substitution of the drugs that is causing, and they can go under gingivectomy or flap surgery if needed. For hereditary gingival stomatitis, that surely because of the increased fibromatous content, so they can straight away go for the gingivectomy and flap surgery for the aesthetic purpose. And the third category is a neoplasm. Either it could be like benign or malignant, so it can be go under biopsy and referral for the respective treatments. Conclusion is that So, thorough history taking is a must for ruling out each type of gingival enlargement and its management, and educate patient on oral hygiene practice. As most of the gingival enlargement is based on the local factors, it could be like exaggerated response or the gingival enlargement. Everything, the main basis is the plaque management and the oral hygiene maintenance. So, it is very important and multidisciplinary approach. As you know that for the leukemia and vitamin C deficiency, you really need like interdisciplinary approach from the other departments and also physician consent for withdrawal or substitution of a particular drug causing gingival enlargement. So that is more important. And finally comes the beneficence. That is the overall like case history and everything. When they work together, you can get a better treatment plan and the better outcome. So that's all for today from gingival enlargement and its management. Thank you.